हमने अगले वीडियो में टॉक किया कि हार्ट फेलियर को एग्जिस्ट विद किडनी फेलियर, मोस्टली इन डायबिटिक, मोस्टली इन एथेरोस्क्लेरोटिक पेशेंट, मोस्टली इन hypertension patient, and mostly in patients who are smoking. They have they are more prone for coexisting disease. Obese patients are mostly involved in heart failure and kidney failure. But the main thing is that in heart failure, HFrEF and HFrEF, there is two divisions. One is diastolic heart failure. In that, wall of the left ventricle has been thickened, so heart filled with less blood, so venous congestion occur and fluid overload occur. In HFrEF, heart failure with reduced ejection fraction, means systolic heart failure, there is a less cardiac output and index, so insufficient blood volume goes to the kidney, and to compensate that, kidney retain water and salt and leads to venous congestion in the legs, abdomen and chest. So both have similar symptoms like dyspnea, swelling on ankles, legs, calf region, swelling on means congestion of fluid in lungs region. So symptoms are similarly same, but the medicines that should be taken by heart failure and kidney failure, some medicines used for heart failure has to be avoided in simultaneously heart failure and kidney failure. If you have heart failure and kidney failure, you should not give ARNI type of medicines. You can give AC inhibitors or ARB. You can give SGLT2 inhibitors, though you are diabetic or not. You can give diuretic in a calculated dose, and advise patients to restrict salt and water as per diuretic dose, and eat heart healthy and kidney healthy food. In kidney disease, you have to avoid excessive potassium rich food and excessive phosphorus rich food, that is must, and excessive sodium. So you have to reduce the sodium intake. You have to reduce the foods that is high in potassium, like banana, nuts, or anything that is having high potassium value should be avoided. And high phosphorus rich product like milk, you have to avoid milk. And you have to restrict protein also. And you have to avoid kandamud, means like bataka, shakkariya, then beets or ratalu. That food grows underneath the earth, that you have to avoid. While in heart failure alone, you are advised to take vitamin C rich food, potassium rich food like nuts, banana, everything you can take in heart failure alone. You can take any type of vegetable. There is no criteria to restrict any root vegetables that grow under the earth in heart failure. But in heart failure and kidney failure, you have to restrict some food like milk that is high in phosphorus, cold drinks high in phosphorus, then potassium-rich foods that I have mentioned in nuts, banana, or all the potassium-rich fruits, you have to avoid it. And you have to avoid kandamura that grow beneath the earth. That is, I have mentioned potato group, all potato, sugar, beet, then all this stuff that is growing underneath the earth. And if you are taking dal should be taken with roti, but the heavy portion of dal, original dal, that is at the bottom and liquid on the upper side. So you have to eat liquid portion and avoid heavy portion of the dal beans. That is most important. So it is a minute things, but it is very much important that you have to avoid sodium, potassium, phosphorus rich food in kidney patients, and also avoid excessive magnesium also in kidney failure patients. While in heart failure, these substances like potassium, magnesium, vitamin C are good. So you have to think properly and prescribe the patients. But in both the condition, one modality, that is FDA approved enhanced external cardiac counter pulsation treatment, that is newly invented treatment for vascular system and particularly congestive heart failure, FDA has approved all over the world. And in renal disease, it improves the renal function by increasing renal artery flow and improve glomerular filtration pressure. So, in renal disease, to decrease the creatinine level and to avoid the dialysis, you have to take ECP by trained certified ECP cardiologist. So my suggestion is that both the heart failure and kidney failure coexist. There are restrictions in foods and fluid. And in only heart failure, there is no restriction of stipulated food except high salty diet. But on the contrary, surgery and stenting weakens heart and kidney failure worsen. So you have to take ECP by trained doctor, under the guidance of the trained doctor. We are treating maximum heart failure with kidney failure patients by ECP and our diet protocol and medical treatment. And the pumping improves, kidney function improves, heart becomes rejuvenated, and they become in a condition that they can walk fast and freely.